Hi, good morning. Hi, this is Andrew Lau, Lowsutea president. Hey, good to see you folks. It was wonderful to actually see so many people from Hong Kong, from Singapore, from Hawaii, from Los Angeles, and from Canada, and some other places in the world, which I'm not sure where they're from. But anyway, I saw quite a bit of people from all over the world. So it's really good, actually. This is going to be an important webinar. Reason is because a lot of people ask me, hey, how come my gut is not feeling well? What kind of problem I have? And I thought it was really good to let people understand, the gut is a very important tool to tell you how you're doing with your health. So that's why I thought this webinar will be very helpful for not only pre-diabetic, diabetic, but anybody actually to make sure they have a good, healthy gut life. And I think that's so important. Hi， 各位朋友，我係 Andrew Lau Lowsutea president。今日有好多人咧，不同地方嚟啦，有羅省啦、Canada 加拿大啦、美國啦、Hawaii 啦、仲有香港、菲律賓啦，不同地方。So it's going to be a really interesting place。好多地方有幾個地方我都唔係好 sure 佢哋喺邊度嚟嘅，但係唔緊要。今日咧好重要咧，就好多人問咗我咧，就話Andrew 啊，我其實咧好 concern 咧。個肚有啲唔舒服或者係大便唔順暢咁點樣㗎？尤其是糖尿病患者係有好多肚嘅問題嘅。咁有個肚嘅問題咧，你就一定要去處理啦。你唔處理咧，如果你唔識處理嘅話咧，係會令到你個肚真係好唔舒服。So that's why 呢個 lecture 我覺得對好多糖友同埋好多病人咧都好重要嘅。So I think this lecture will be very, very good for all our pre-diabetic, diabetic patient, so they can able to have a better understand how to get a better gut health. And can really diabetic affect your gut? Yes, that can be affected, and that's what I make you to better understand it today. Okay, so I want to thank you for your attendance. But because of the lot of people comes in, I don't know where they're from. So I thought perhaps it would be good so I could able to provide some basic information to make sure that we are on the same page. So I'm going to spend a little time to talk about diabetes, how they started off in about 5-10 minutes. So that way you can all catch up and go from there. So now let me do this first, and then so make sure everybody see this. So today, this is what we'll talk about. Will the gut be affected when you are pre-diabetic, diabetic? And the answer is yes, it will affect. So what I will do is for now, I'm just going to catch real quick for first 10-15 minutes, 10 minutes basically, limited time to better understand what is diabetic, because we have so many people from different part of the world that comes in, so I want to make sure everybody catch up to everybody same level. First of all, everybody understand diabetic is a chronic disease. You don't get well. All you can do is control, and it affects the entire body because the reason is they start plugging blood everywhere. Everywhere you go, form plaques everywhere, your head, your heart, your kidney. So it will damage entire body vessel. That's why really diabetes is a very long-term chronic disease and be really sad if you get it and don't treat. You get definitely have all kind of chronic problem come along. What you gotta do is keep your A1C below 6.4%, so that way you always be in a safe mode of blood sugar, and that result you don't create long-term diabetic complication. So how do you control your sugar? Very simple. You have to, pre-diabetic, diabetic is the same thing. Control your sugar, you have to basically make sure that you have your good diet control, you have to exercise, you have to weight management, and then you have to measure your blood, because if you don't measure blood, you will not know. And certainly you cannot really eat a lot of white powder food, meaning your rice, your bread, and you have to not drinking all the very sweet juice, and or soda water. I mean, really like Coke and things like that, because they are so high content of sugar. And then at the end of the day, hopefully you drink some Lowsutea can help you lower blood sugar. So that will be really at the end of the day, controlling sugar through dieting. You have to exercise and weight control make all the difference. I can tell you why a little while later. I can explain to you. Now, how diabetes are being formed. Basically, the first stage, usually the LDL goes up. When LDL goes up, they will damage your pancreas B cells. The B cell is the one that will get the sugar into the cells. If that is damaged, more B cells come out. So end result, you get more insulin resistance. More and more insulin resistant, then more sugar will be increased. The sugar, the stage 2 coming in, the sugar and the LDL cholesterol mixed together, the blood become very thick. When it becomes thick, the sad part is your sugar and cholesterol will form plaques for the entire body, throughout the body, and the long-term can form plaque. So you're going to have long-term health issue, like you can be damaging your other nerve, you damage your heart, your kidney, everything, okay? So that's stage 2. And then stage 3 is when you, and stage 2, because of all the plaque, your blood pressure goes up. So first stage, cholesterol goes up. Second stage, blood pressure goes up. And your blood sugar continue to be high, then you move to the third stage, which is called pre-diabetic. Pre-diabetic means that is your hemoglobin cells, the red blood cells, the amount of sugar attached to the cells is going to be normal person 5.7, and now you'll be etching up to 6.4. During this range, you are pre-diabetic. And then if you don't do anything, don't try to diet control, exercise, you move to stage 4, which is a diabetic. Anything over 6.5, you are a diabetic. That is, everybody goes through these 4 stages. I want to repeat that because a lot of people came in new, so they has to know, okay? And people don't, you know, our old friends maybe hear repeat one more time, but it's okay. You're going to always remember. 嗱，各位糖友記住，糖尿病就可以唔好嘅，只係控制嘅啫。點控制啊？就要真係糖尿病前期患病都係同樣咁控制嘅，就一定要將佢 A1C 降低啦，要唔好食白粉啦，要做 exercise 啦，要度血啦，同埋撈佢個磅啦，或者可以飲類糖茶啦。嗱，記住糖係永遠都唔好嘅。咁記住咧，原來糖尿病有4個 stage， 第一個 stage 咧。就係個膽固醇高上去，咁膽固醇高上去嘅時候咧，佢 damage 晒啲 B cells，B cells 就帶啲糖入去個細胞裏邊。如果 damage 咗，咪變咗好多叫做所謂叫呢個胰島素抗拒啦。越整越多啦，咁個糖又高啦，咁就成身咧同啲糖同埋胰島素咪個糖同埋嗰個膽固醇加埋一齊咧，嗰啲血就變咁好厚啦。咁好厚咧就 form 嗰啲 plaques 咧。呢咁嘅硬塊啦 all over the body， 咁就好弊啦，因為咁咧就會塞晒由腦啦、心啦、腎啦，度都塞嘅，咁所以話長遠病咧，呢個係最大嘅問題。咁同埋咧，當你係繼續唔做嘢，繼續係一路咁生活，咁如果咧係咁嘅話咧，你個 A1C 咧就係紅血球嗰啲糖 percent 啲糖 attach 嗰個紅血球咧，一路上去嘅，由 5.7 normal person 一路上去就 6.4。呢個 range 裏邊咧，呢個叫做前期患病者，嗱繼續唔做嘢，繼續唔降低糖，你過咗 6.4 咧就 6.5 咧，咁你就糖尿病咪啫。個個人都 go through the stage. So how does Lowsutea work? It's very simple. We have 2 products in there. One is called the guava leaves, which actually blocking sugar into the gut vessels. And then you have bitter melon, which is really act like insulin. What it does is actually increase the insulin sensitivity. So get the insulin, get the sugar into the cells. And the excess sugar, they will dump it out through the urine, and they dump the cholesterol also out and the salt out. So net result, your 3 high will come down. One is your sugar come down, your cholesterol come down, and your blood pressure eventually come down. Plus it will detox because any waste will dump it out. That's why you drink Lowsutea, your urination will be higher. 嗱，各位朋友，飲虛糖茶有2種嘢裏邊咧，一個就係番手葉，佢就將啲糖咧唔好俾佢咁入去嗰個微絲管血個腸嘅細胞個血管裏邊，咁冇糖入去咧就咁多糖入去啦，咁佢哋咪變咗係少啲糖喺血管裏邊啦。咁第二樣嘢咧，苦瓜咧係帶啲糖，好似胰島素一樣，佢係將個胰島素 increase 咗個sensitivity 啊，咁佢將啲糖咧就帶翻佢入去細胞裏邊。咁仲有咧 excess 嘅糖咧掉咗喺個尿嗰度啊，掉晒出嚟。 同埋咧佢掉埋 cholesterol 出嚟，仲要掉埋嗰個鹽出嚟。咁3樣降低咗佢嘅鹽啦、cholesterol 啦、同埋糖啦，咁你血壓亦都會降低，同埋仲有 detox， 所以呢個咧係一個十分好嘅飲品。Okay, if people don't do anything, what's going to happen? The consequences are the following. One, you're going to have a risk of stroke. You can have cataract problem. Plus, you will have potential pancreas malfunction. Your insulin doesn't work anymore, or your common insulin doesn't work. The worst problem is your heart. If you get heart problem, 30-40% of the patient will get heart disease. 40-60% of patients get heart disease. So that is a very big amount of patients with diabetes get heart disease. And that result will end up with heart attack and so forth. The worst thing is the nerve damage. As a matter of fact, that's the part that I want to talk more about today. The nerve damage is actually damaged not only the nerve on your head, which you can feel, you can have a sense of pain or whatever, but worse that it affects all the different part of nerve, the entire body, like the vagus nerve, the nerve of the stomach, or nerve everywhere, because the sugar will damage all these nerves, and you will not feel the lower extremities and all the different places. That becomes a serious problem, because if you hurt your leg, you can feel you get infected, you actually end up cutting a fit, and your blood vessels, because of all kind of plaques, will damage your blood vessel. You get high blood pressure, it damages your vessels and kidney, then you cannot filtrate anymore, you end up with dialysis. And 30% of diabetic patients have no sex function. The reason is they can't feel. Wow, that would be really sad. Certainly pregnancy women, if they have gestation diabetic, you have to watch, but eventually you might end up with diabetes. So all these things has to be a potential complication if your blood sugar goes up high. So very important. You really need to change your lifestyle to make sure the blood sugar coming down. 嗱，各位朋友，如果你話我乜嘢唔做啊，會唔會有問題啊？好大問題，因為咧糖尿病咧係一個一世嘅病嚟嘅，永遠唔好嘅。咁如果你唔做嘢咧，你糖尿病高嘅時候咧，咁就當然啦，你會有中風嘅驚險啦，中風嘅風險啦，仲有 affect 咗你腦之後咧，可能有啲你塞咗之後咧，你記唔到嘢啊。咁好多老人家咧，我唔知你睇到你婆婆啊 whatever， 問你買10幾樣嘢都係日日都係問嗰幾即係1-2分鐘問你啲嘢咧，佢啱啱先問過嚟嘅。咁其實嗰啲咧就係因為塞住個腦記唔到。咁仲有青光眼啦、隻盲啦，其實有好多依家糖尿患病者好慘嘅，佢係30-40歲已經有呢個青光眼，開始蒙啦睇嘢，睇唔到，好陰功。咁仲有咧，仲有你個胰臟壞咗啦，咁同埋要打胰島素啦。同埋最弊咧，40-60% 嘅病人咧係有心臟病，因為塞咗啲血管啊。咁仲埋咧，仲有一個神經系統損壞，亦都好弊嘅，因為你感覺唔到，咁你就唔知道係點，咁整親又冇感覺啦，咁變咗嚟講會發炎啦，令到一個唔好嘅時候，你腳咗佢咧就好多時係呢啲咁發生啦。咁同埋咧嗰條血管係咁塞咧，塞咗之後咧，咁你血壓會上高啦。同埋啲血管 damage 咗之後咧，唔翻轉頭啊，唔好唔記得。咁如果你血管真係 damage 晒，好似 for example 喺個腎血管 damage 咗咧，咁又會過濾唔到啊，咁你要洗腎咯。咁仲有啦，30% 嘅糖尿病者咧係有呢個咩問題咧？冇咗性功能，因為佢冇感覺，所以呢個係一個好大問題。咁仲有咧，如果你係 pregnancy 咧，即係有生育嘅時候咧。咁如果你有 gestation diabetic 咧，咁呢個咧就 eventually 亦都有機會咧有個長遠嘅diabetes 嘅。咁so in our way to help everybody out is we created 5 program. 5 program is basically not only asking you to drink Lowsutea, but the 5 program is to help you to learn about diabetic management. And that's what we're trying to do. All these things is diabetic management. When you have diabetic management, we'll ask you not to drink Lowsutea, but teach you about how to get diet control, how to lower your lower carb and lower fat, lower your cholesterol. We'll teach you about exercising, so you make sure that you can do exercise, you lower sugar. Plus, we have all these weekly webinars, and this weekly webinar, it doesn't matter if you didn't have time. No worry, I send you the retape so you can listen to learn. So you can be aware of what's going on. Plus, you have to do a blood tracking. So many of our patients, A1C was 10+%, who dropping down to 5.7. We have a lot of examples of that, and people are just appreciate. Matter of fact, that's the reason why people said that we are giving the gift of life. 嗱，虛糖茶咧好簡單，我哋個心咧就唔係話淨係俾啲茶去飲，仲有一樣嘢係教你點去管理嘅糖尿病。嗱，其實世界上咧好多國家都冇呢樣嘢俾去教你管理，俾一個 lecture 你算數。我哋咧係差唔多每個月每個禮拜啊，都俾啲資料去滲入去咧，你繼續 build up 你個糖尿病嘅管理嘅知識。咁當你有好多呢啲知識嘅時候咧，你就變咗嚟講一個十分好嘅人咧，令到你話哇，我能夠做到咁多嘢㗎 ，very good 喎。咁我又會去即係開始更加管理啦，喺食嘢方面啦、exercise 方面啦、磅數方面啦，同埋點去度血啦，同埋咧去聽我哋 webinar 即係你每個禮拜 webinar 啦，降低 A1C 咧由10去5啦。哇！呢個如果你咁做晒呢啲嘢，你一定會好健康。當你好健康嘅時候，藥會降低，你個人都 feel very good 嘅。所以咧，呢個係十分好嘅大家一齊努力。我哋嘅 concept 咧係 holding your hand 拉住隻手，一齊同你一路咁行，能夠令到你咧身體更加健康。So our goal is work with you and holding your hand throughout your diabetic journey to get you to be always in good health. So you won't have conversion, diabetic conversion, pre-diabetic conversion, diabetic. If you are diabetic already, we don't get you to be diabetic complication. You can be healthy and enjoy your life. And that's our goal. So today we will talk about how the gut will be affected. You will be diabetic. Okay, this is our today topics. Okay, so first of all, many diabetic patients, they pay so much attention, just lower the blood sugar by diet. And I found that many programs throughout the market, throughout wherever, they all talk about diet. Yes, diet is very important, but they forgot about all the other stuff that will also affect them, like heart disease, stroke, blood pressure, kidney disease. They hardly talk about that to prevent those things. But those are even bigger problems. If your heart is not working, I don't care what you do at blood sugar, it won't work anymore because you die. And same thing, if your kidney not working, you know what? That will be tremendous suffering because I work with kidney dialysis patients throughout Asia. And I found that earlier when I introduced a new therapy called CAPD, at that time already, this is 1985, 50% of my patients are diabetic, 50. Now, 75% of our patients are pre-diabetic. I mean, are diabetic. 75% from 50%, it jumped up tremendously. So people are now realize, oh my goodness, there's a lot of people can prevent potential became a kidney dialysis patient because at that time, if they can stop early, they don't have to go through all these really tough lifestyle where every day they have to dialyze, or if they go hemo, they have to go to hospital 3 times a week. Wow, that would be terrible. Plus the cost will be tremendous. So the way how I describe today and next week when Professor Larry Chan, give you the lecture, how to prevent the onset of kidney disease and how do you have go through the progression of path of kidney disease because of diabetes, that will be a tremendous lecture for you. So make sure tomorrow, next week on the 26th at 11 a.m., listen to the lecture. If you haven't registered yet, do register because that is truly a very benefit to understand. I have several patients, and these patients are really, at the end of the day, they live about 10 years with not much problem, but didn't realize the blood sugar really screwed up the kidney, and now suddenly they're desperate. So I will tell you more next week. But really sad because I work with many of the dialysis patients and they are suffering. And I don't want to, if I could, have the power to educate you earlier and you have prevented suffering, wow, I did my job. I will be very satisfied and happy you guys have a better life. So many of them actually, even with the pre-diabetic, diabetic patient, many of them are actually surprised and say, wow, you mean it will also affect not only my heart, my blood pressure, but affect also my gut and create all kind of problem for me on my GI tract, which is the gastrointestinal tract, which is absolutely true. A lot of people don't recognize that, oh, I didn't know if I'm pre-diabetic, diabetic, I will affect my gut. And that's why many diabetic patients start seeing the gut pressure, gut problems start showing up. Besides, when they have high blood sugars affected the nerve of the stomach and the intestine. So one of the most common thing, the first seen for pre-diabetic, diabetic patient is constipation, because affected those gut nerves. So you already start getting some symptom that will affect them. So they actually need to very early stage have to talk to the doctor. I can't go, you know, and people cannot go. It's very frustration. I can tell you that. I have a lot of patients telling me, oh, Andrew, I cannot go. Now you might laugh. This how can you call Andrew for you cannot go? But I can tell you a lot of people cannot go is something that affect the you know, the whole thinking process, very frustration. So that's something that if I can help you with this, I think I did my job. So that's what I'm trying to do. 嗱，好，糖友好多時間咧，我哋好多時咧係注重咗，只係話啊降低血糖食啦，唔好食咁多澱粉質嘢啊 whatever 啦，係記得食，或者有陣時咧 pay attention 咧，即係去控制血壓或者其他地方就冇講下，哇原來咧糖尿患病者咧係好多人咧又係前期同埋糖尿患病嘅時候咧都可以係。你影響到你腸胃嘅問題嘅嗱，好多人咧其實都唔知道呢樣嘢，其實係好常見，同埋仲有咧，當你血糖係高嘅時候咧，你血糖咧係會 damage 去損壞你個所有嘅肚裏邊嘅神經系統。當呢啲神經咧損大嘅時候咧，好咧就唔 work 噶啦。咁陣間咧就會介紹下邊嘅嘢係最重要，令到你神經喺度唔會 work 咧。咁第一樣嘢好多人常見係乜嘢啊？就係你變到咧係會覺得你係去唔到大便，你會覺到咧係哇死啦，成日都好似便秘嘅，去唔到嘅，好唔舒服喎。嗱好多時咧你唔知道原來便秘咧令到好多人口猛疾嘅，哇！去唔到啊，好唔掂啊，好唔舒服啊，咁變咗嚟講咧，好多人咧其實咧就個心唔話俾你聽，但係便秘係一個好大問題，即係令到你成身好似唔舒服咁嘅。我唔知你有冇感覺到啊？咁但係我自己都有嘅。如果我去唔到咧，我覺得好怪嘅。OK， 咁所以變咗嚟講咧，喺呢方面咧，今日我講嘅去糖即係我哋個成日今日個 webinar 咧係關於呢樣嘢，令到你咧更加多了解。咁前幾排都有個 webinar 講係咩叫 Constipation 啦，咁我亦都講過好多嘢俾你聽啦。咁我今次咧係講更加重要啲咧係點解你會令到你咁。首先我哋講講咩叫做係健康嘅腸胃咧，同埋個腸如果係真正好健康係點樣咧 ？So first of all, I'm going to talk about let you understand what is a healthy gut. If they function properly, how does it look like? And they're able to digest what it look like. Because if you understand what is the healthy gut, you have a good benchmark to understand, this is healthy, okay? So you will not have to be worried about what is an unhealthy gut, right? Because now you know what is a healthy one. So you have a benchmark to measure. But more important is really the gut to be healthy, you got to have good bowel movement. Bowel movement is the indication of healthy gut. A lot of people may have 1 or 2 times per day with a bowel movement. Many of them maybe 1, but some of them have 2, but that's okay. As long as your bowel movement, the stool are easy to form, it parts are easily come out, and you have no symptom of diarrhea, you have symptom of constipation, you have no loose stool, and your rectal does not have like hemorrhoid because you can't come out, you correct hemorrhoid. So start bleeding. That's not good, man. Okay, so you don't want to have that. Plus, you have also frequent abdominal symptom like gas that always have feel my gas, I don't feel good, and I have bloating, and I have also abdominal pain. If you don't have all that, you have healthy gut. So that's why I want to first identify what is healthy gut, so you get that benchmark, and we'll talk about what is not healthy, why diabetic will affect you. 嗱，各位朋友，其實點解我首先咧講俾你聽咩叫健康腸嘅功能咧，同埋你嘅消化系統成個工作裏邊咧，咩叫健康咧？如果你唔知道咩健康嘅時候，你冇一個 benchmark 去 measure 你自己，去個度尺俾你去 measure，原來呢個叫健康嘅。嗱，好簡單嘅呢個。第一，如果你有健康嘅腸胃咧，最緊要咧你係去大便係好舒暢嘅。你可能去大便咧係1至2日嘅1至2次嘅大便一日，即係每日可能你屙2次啦，好多人屙1次嘅啫，但係有啲都攞2次 OK 嘅。但係最重要咧，屙大便嘅時候咧，你一定係要你大便係好順暢啦，同埋咧嗰啲大便好似一條出嚟啦，好似香蕉咁啦，就唔係一粒粒啦，因為一粒粒咧就 constipation 記住一粒粒就上個。幾個月前咧，我講過 constipation 啲大便咧，如果一粒粒出嚟好細粒咁單粒嗰啲咧，呢個就係 constipation 唔正仔嘅嚇。咁同埋咧就係你冇即係去肚屙嘅肚瀉嘅跡象咧，亦都冇便秘嘅跡象咧，亦都冇呢個啲好稀嘅大便咧，冇呢樣嘢咧，咁呢個係健康嘅。咁仲有一個好重要咧，就係你個腸肛門嗰度咧，唔好搞到出嚟咧有痔瘡，哇好弊喎！因為痔瘡有痛流血，同埋咧如果更係差咧，你要做 surgery， 做翻啲 surgery 亂翻佢嘅，咁好煩㗎，因為咧做呢啲咁嘅 surgery 咧係好唔係好舒服嘅東西嚟嘅，咁所以變咗嚟講咧，你要 make sure 咧冇呢啲嘢，所以坐唔好太過大便去谷啊，咁同埋仲有咧你個肚嗰度咧唔會有好多氣啦。如果你好多成日肚脹、氣同埋呢個腹部又脹又痛，咁其實咧呢啲全部唔健康嘅。所以其實咧點解會俾呢個 indication 你先，俾個尺你先，咁你知道啦，呢啲我健康嘅，冇呢啲咁嘅症狀咧，我個肚咧係十分健康。所以呢樣嘢咧，你首先要學咗先。Okay, so very important. I give you now the benchmark. What is a healthy gut? Now, then we'll now talk about what is not healthy. Okay. The real problem is if you are not actually, getting control your blood sugar continue to be high with A1C of 10% plus. Your average blood sugar is always 10 or 180 and above or 160 all the time. Now you're going to have a real problem. The most common problem you're going to find is constipation. Now what is defined as constipation is 3 days or more, you have only one one bowel movement coming out. So the fewer bowel movement, and every time you go, you have to strain. And also you have to hard time doing it, and still come out with one piece and one piece so small little one. Okay. And that's why, actually the stool will all accumulate on the lower bowel and doesn't come out. And you found that, wow, it's really hard, man. And it doesn't come out. And that can be very frustrating because you feel it, but you can't empty it. And then you really feel very bad because you can't empty the stool. And a lot of times that because of that, your stomach hurt, your gut lower bowel also hurt. So it's a not very kind thing. Now, I can tell you some more thing that is very important, especially elderly. Because a lot of people don't realize when you are 65 and up or even 60 and up, the chances if you have to force yourself every time, you know what? Especially your diabetes, you're most likely your blood pressure not well controlled, for example. Now that is going to import you setting yourself a potential stroke problem or heart attack even. The reason when you stress, your blood pressure can go up as high as 180 or 200 even if you don't stress it correctly. And I can see a lot of my ICU patients, which I used to be an ICU nurse, you remember. They came in because they have stroke, because the strike of stroke is what? It's because they went to have the bowel movement. They didn't do it well. So they start forcing themselves real hard. And the blood pressure went up to maybe 200 or 200 more. And guess what? The brain just go pop, pop, burst on certain vessel. And right away, they got left side or right side suddenly become very weak. And they start getting the stroke. So that I would suggest everybody over 60 has to be very careful to remember, make sure that bowel movement is nice and sweet, and do not force yourself. And those are the problem you're going to have. Now, if you're going to look back, remember my teaching, if you have problem or nerve, we're pushing this, using your pressing here, and to stimulate your bowel movement, your gut using here. Remember this thing? So you can do that. Hopefully look back on my lecture, some of the things that we'll do, pressing on the here, pressing this part, okay? Pressing here, and then pressing here. Also the, right here, to get yourself to stimulate those bowel movement nerve, so you can have better, bowel movement. So do not stress yourself. Don't go, because if you are 65 or 60 and above, you have a risk of stroke. And I saw so many cases. And so what can you do then? If you say, I always have hard time. Well, I found majority of the people who are diabetic or pre-diabetic, you know what? They didn't drink enough water, or they don't drink enough Lowsutea. And that's the reason why I get 2-liter Lowsutea for you to drink every day. There's a reason, because if you can drink 2-liter or 1500 cc, you have enough lubricant to your whole bowel. So you have to have fluid to come through to lubricate your bowel movement, to dump the stool out. If you don't have that, you know what? You're gonna have a hard time, because the stool are hard, are constipated. You have not enough water to help you push up. So drinking water or drinking Lowsutea, if you have 2-liter Lowsutea, I'm very sure you're gonna have enough fluid to help you to move the bowel. So drinking fluid is so important. If you're dehydrated, most likely you also potentially get your what? Constipation. Now, also another thing, drink warm Lowsutea can be also very good. The warm stomach relax you, can also help you to lubricate your bowel, and then you can also, pass it out. Now, you can also add fibers to your diet, or vegetable to your diet. Cut down on carb, but a lot of fibers, because you eat more fibers, and plus you mix with the water, you form your nice bulk. And your bulk is help you to formulate and get your stool to come out easily because of fiber. So very important, you gotta have bulk to help you. Now also you can get some brand, but not a sweet brand, but is a brand cereal that also very high fiber to help you push it up. Now, very important, you also need to have some exercise. Exercise, very simple, walk and do it. You don't need to do a lot, just walk. And then one more thing a lot of people don't realize, once you have the urge, you have to go. Don't hold it in there, because the more you hold it, the stool might get dried up, and then you have a hard time pushing up. So when you're ready to go find a restroom to do the poop. And then you get, the urge is so important, time to it, just do it, okay? So these are the tips to do that. Now, one of the people that also asked me, well, if my fiber doesn't work, should I eat a lot more like dependent on laxative? Not good. You don't want to depend on laxative. If you depend on laxative, you might actually become total dependent. Once no more laxative, it doesn't work. So I will not suggest laxative. However, you need some metamizole. Yes, you can do some of those, but not fully dependent all the time. Get more diet in the, in your actual fiber diet. Like for example, eat a lot of celeries. That will be really good because high fiber. As long as get fiber vegetable and then low carb also. Eat more of those. It will be better for you. OK？ 嗱，各位同友，嗱我講得詳細咗啲嘅。第一就係知道咧，原來咧，當你血糖係繼續高上去嘅時候咧，有一樣嘢會 damage 咩咧？就 damage 你個腸胃裏邊嘅神經。當你腸胃嘅神經係開始破壞咧，咁有一個第一個係最多人常見嘅係咩啊？就係便秘啦。咁咩叫便秘啊？便秘就係每3日係你去一次咧，呢個真係便秘，同埋啲大便係一粒粒咁樣嘅，一粒細細粒彈出嚟嘅。咁同埋咧，你係便秘嘅時候，每次去咧你好辛苦，要谷出嚟嘅。咁同埋咧，當你大便係慢慢谷出嚟嘅時候，你覺得係好唔妥嘅人，即係好 frustrated 啦。咁因為你覺得哇好唔出到嚟喎，咁你就會好猛嘅。咁同埋一個人咧，亦都有個肚脹啊感覺啊，同埋咧你覺得咧哇成日都去唔晒嘅，仲有啲嘢喺裏邊嘅。咁你會有呢個感覺咧就唔舒服嘅。咁你好多時咧有人有胃痛啊或者腸痛啊呢啲東西啦。咁呢個成套咧你都覺得唔舒服。嗱好重要啊！千祈咧，如果係60歲以上咧，就唔好谷出嚟，因為你當你谷呢粒出嚟嘅時候，好多時咧你 end up 就有咩有個 heart attack 啊！因為咧我嗰陣時 ICU nurse 嘅時候咧，好多病人咧入嚟咧中風咧或者係 heart attack 咧，都係因為咩啊？谷大便。因為一谷嘅時候咧，個血管去邊度啊 ？boom 去到180或者200以上，唔出奇嘅。咁你腦係你唔知有邊個血管係唔係咁正仔咧？咁你谷得好緊嘅時候就喺嗰度爆 ，boom 一爆咗之後，忽然間左手右手冇晒力，又有是但一邊都冇力，或者個人開始暈暈陀陀，起唔到身。咁呢個咧就係變咧你係中風嘅問題啦。所以千祈唔好話以為冇緊要谷大便啦，呢個係唔好嘅。咁所以咧，你一定要繼續咧，係將你大便係出嚟要舒暢。咁有一樣嘢好重要咧，點可以做能夠令到你大便出嚟舒暢啊？飲好多水。咩叫多水咧？每日要飲2公升至1500公升嘅水，或者飲去糖茶啦。所以你過去飲去糖嗰啲人咧，係好容易去嘅原因咧，就係因為第一，去糖茶裏邊已經有好多 fiber 嘅，因為苦瓜同埋番茄係 fiber 嚟嘅。仲有咧加水2000個 cc 或者1-2個 litre 啦，係能夠將你大便好 lubricated， 可以滑咗佢。咁同埋咧朝頭早咧，仲有咧係可以飲一啲暖嘅去糖茶或者熱嘅糖嚟 OK 啦。咁亦都令到你個吉咧係開始好舒服同埋去即係 relax。咁你去大便嘅時候咧就好容易去啦。咁仲有一樣嘢好重要咧，就食好多 fiber， 好多有纖維嘅蔬菜啦。好似芹菜啦，呢啲係好重要嘅，食多都唔怕，因為佢係 carb 係低嘅，但係俾好多 fiber 你。當你有個 fiber， 即係你個纖維，再加水，就俾到個大便能夠有好好嘅包，即係有大便嘅一嚿嘅大嚿啦。咁嗰樣嘢就加咗水之後咧，有 urge 就會彈咗個大便出嚟㗎啦。咁變咗嚟講咧，亦都有啲人咧就中意食嘅 cereal 啦。咁可以叫做 brand cereal 都唔錯嘅，因為嗰係好 high fiber 嘅，但唔可以 sweet 嗰種啊，即係唔可以有甜嗰啲啊，麥片啊，唔可以麥片，要唔甜嘅。咁同埋咧，仲有去 exercise 啊，即係去走路啊、行路啊，其實行就得㗎啦，一定要繼續行。咁同埋仲有一樣好重要咧，就係如果你忽然間諗住我覺得要想去咯喎，就唔好 hold off 去，因為咧你唔去嘅時候咧，可能嗰啲大便開始乾啊。咁你就開始爛出嚟啦。咁呢個係一個好重要嘅，一講得去就去啦。OK。咁仲有一樣嘢好重要，有啲人就話：喂，咁我咪又係去，即係又係走去食啲laxative 啊，或者大便嗰啲藥啊。嗱，唔好繼續食藥啊，因為藥咧食咗之後咧會 dependent 嘅，即係繼續話你唔食藥就唔 work 出嚟啊，咁就好弊啦。咁所以變咗嚟講咧，就盡量食多啲 fiber， 即係用咗 natural 嘅方法咧，你會更加舒服好多。OK， 得唔得？OK， 咁繼續努力，因為大便咧係你一生人裏邊咧一個常見到係幫助話俾你身體係咪有咁健康先。So one of the key thing, diabetic damage the GI tract because the nerve damage is what is that nerve? It's called vagus nerve. Okay, vagus nerves will come here, go directly to the stomach. Okay, this is actually a picture of the vagus nerve go all the way down. Now, this branch of vagus nerve actually will basically is signal the stomach muscles that will, and all the way to the small intestine to move the muscle to push the food down to the small intestine. And that's what the vagus nerve do. But if you damage the nerve, so the nerve is not functioning that well, so the nerve will not push the food down to the stomach, from the stomach to the small intestine. So net result, you're going to have what they call a term called gastroparesis. In other words, your stomach no longer push the food out to the small intestine anymore, or very slow pushing out. And your symptom is you're going to eat few bite of the food and you're going to feel full. You're going to have very fat discomfort of the meal. You're going to have stomach that you feel bloating, like the stomach feel like, wow, it feel really feel bloated, you know? And you sometimes some bad feeling will like feel like throwing after eat some. And also a lot of people get stomach pain. And then the worst that because of that, you are very hard to control your blood sugar, because you got blood sugar go in, I mean, you eat that go in, you don't know you can able to convert or not convert. So you can have high and low. So this is one of very common nerve damage from diabetes. So a lot of people diabetic will, when they got that, they will have that issue, okay? So very important, you gotta really control your blood sugar. And I'll show you further, figure out how do you work with your damaged vagus nerve, okay? 當你有糖尿病嘅時候咧，一個好重要嘅問題咧，好多人咧就個神經系統損壞嗰個神經系統咧，就叫做 vagus nerve，OK？ Vagus 呢個啊 vagus nerve， 咁呢個 vagus nerve 喺度一路落去咧，就 connect 到呢個 stomach 同埋大個小腸嘅。咁當你係做呢樣嘢嘅時候咧，好多時咧個問題咧，當你 damage 咗之後咧，你個nerve 唔該話俾你聽嗰個 stomach 全部嗰啲 muscle 咧，去推啲食物由個胃嗰度推到落去個小腸嗰度。當你如果你唔即係唔去推嘅時候咧，咁你食物咪其實留咗喺胃嗰度咯。咁邊嚟講咧，好多時咧，當你有呢樣嘢，你食咗好多嘢嘅時候咧，你食物咧就其實成咗胃，唔去個小腸度。咁你感受咧就好大問題啦。好多人食咗少少嘢就覺得唔飽噶咯喎，其實你唔係飽嘅，啲食物唔推落去啊嘛，唔推到小腸嗰度。咁仲有食完嘢之後咧，你好多時咧就覺得肚好似脹晒，嗰個胃啊好似脹晒咁，唔係好舒服，直情係好唔舒服。仲有啲人咧，當係時間較差嚟咧，就想作嘔添。咁同埋仲有好多時咧有個肚痛嘅問題。咁同埋咧，呢啲咁嘅人咧，多數有好大問題，糖尿病病者佢嘅 blood sugar 咧就好難 control 嘅，一係好低就係好高，所以其實咧呢個係一個好大嘅問題。好多時咧，多數糖尿病病者咧，如果佢有個胃嘅問題啊，多數就係呢個 damage 個 vagus nerve 就係因為佢個糖高得滯，一路繼續去 damage， 咁 damage 咗個 vagus nerve 呢個問題就一定出現㗎啦。咁如果係咁嘅情況下嘅時候，咁我要做啲乜嘢啊？嗱，如果你係個 case 係 mild 嘅話，第一定控制你嘅 diet 啦。咁控制嘅 diet 咧就係唔可以食好多 high carb 嘅，食好多 fiber 嘅嘢啦。For example， 食 celery 啊，食嗰啲菜啊，食晒差唔多4/3都係菜，或者更加多菜。咁你嘅時候咧，你就希望咧用呢個方案咧減除咗好多糖。但係加咗好多 fiber， 咁落到胃咧，咁唔繼續 damage 個 nerve 咧係 good 嘅。咁仲有咧，可能醫生一定要俾藥你食。嗱，藥咧係會係幫助你啦。咁仲有，如果你真係好 severe 嘅，即係你淨係好差㗎啦。咁依家咧就醫生咧就可能咧擺一個叫做 stomach stimulator 俾你，咁就令到你個 stomach 咧stimulate 個 vagus nerve， 咁能夠令到佢咧就個 nerves 好啲咧。咁你就可以 push 嗰啲食物落去細腸度。咁呢個咧係一個會係有一個好嘅東西啦，幫助你啦。Okay, so if your nerve are real damage, one of the things that basically you can maybe change your diet, basically a low sugar diet or low carb diets, a lot of fiber like a celery and so forth, and help you. So your diet will be low carb and also contain high fiber, able to push it out to your small intestine. Your medicine, doctor might give you medicine, and if you have a very severe case, most likely you're going to have a stimulator inserted by a doctor and put it right to the stomach area, which you can stimulate to get your nerve to work better to continue push your food down. So very important that vagus nerve damage is really slow down your entire, stomach pushing food from the stomach down to the intestine. So we gotta fix it, okay? 所以記住，如果你 vagus nerve 如果係即係破壞咗嘅時候咧，真係要揾醫生去睇啦。第一，可能醫生擺個 sense 有 stimulator 喺呢個 stomach 嗰度啦，就將你嘅食物推落去個胃啦，由胃推去細腸啦，去食藥啦。咁同埋咧，即係 changing 啊，即係轉咗你嘅 low carb diet 低糖同埋多 fiber 係會幫手嘅。OK。Now, we have a lot of patients also that are long-term diabetics already, and the nerve are actually damaging not only the stomach, they also damage the small intestine, they also damage the colon, damage the rectum. That means the last part of your gut. So all that you are damaged, that's the terminology diabetic enteropathy. And that means basically your entire gut are being screwed up and damaged. So really, at the end of the day, you got to figure a way how to help this when you damage this entire body process. How do you get this better? Now, I'm going to first of all show you what is the reason why you have this damage and why you're going to get that bad. Now, when you have nerve damage, for example, the large intestine, which is the big bowel, like this thing here, the whole thing is the large intestine. The problem is that when your food you ate and it slowed down the body process to process your food. And then if it's not well processed, you're going to form constipation. In other words, you're going to get a lot of constipation. Now, when you are unhealthy forming this constipation, the body is going to react to it, and you're going to have more bacteria to formulate in a large gut. And that result of that, you have a tremendous amount of bacteria, excessive, overwhelming bacteria in your gut. Now, normally you do have bacteria. It's called normal flora, but it's okay, help you digest. But because of the slowing down, your gut has no way to continue to process properly. So you have humongous of bacteria, and that is not good. And then that result of that, because of all these bacteria, first as a symptom, you're going to start getting diarrhea. And also you can have a symptom of diarrhea and constipation together. And then you will feel so uncomfortable. You have diarrhea and constipation together, or some one or the other. So you will be very, very uncomfortable. And this is usually the first sign of the diabetic enteropathy. So that is the first difficulty you will start doing. On top of that, because of the fact that you can have difficult to control your bowel, now you're going to have a stool leaks from your rectum. You know where you can't control it. So you're going to start have small stool dripping up, especially leaking out. And especially after you eat, you're going to have a lot of that. And then your panty is going to get dirty. So you really need help from the doctor. And most likely the doctor first is control the bowel bacteria. So going to help you, give you some antibiotics. And also they will give you a very good thing, probiotics, which is normal flora to help you reform the bacteria, the good bacteria, rather any bad bacteria go inside. So that is usually a treatment. But you need doctor to help you because you need to get the bacteria to clean up the, first of all, you clean up all the bad bacteria, and they probably give you some probiotic to help you. So this is something that you got to treat by doctors, okay? 嗱，好多糖尿病者如果係好長嘅時間已經係糖尿病咧，咁好多時咧佢因為已經喺個大腸嘅 嗰啲神經系統咧已經有一段嘅 damage。咁個 damage 唔係淨係個大腸，亦都 damage 細腸，亦都 damage 個膀胱，即係同埋個 rectum。咁你變咗嚟講咧，就係即係好多地方喺個直腸裏邊都 damage 嘅時候咧，好多時咧你食咗嘢之後咧，你個腸就會係好慢推啲食物落去個肚即係個大便嗰度嘅。咁變咗嚟講嘅時候咧，當你係嗰啲食物好慢落去嘅時候咧，咁你就 form 咗一樣嘢唔係好正仔係咩咧？就 form 咗好多微菌喺裏邊咧。因為我哋好多叫做好嘅微菌係幫佢消化，但係當你太多嘅時候 overwhelming 咧，咁啲壞嘅 bacteria 咧，嗰啲就會走出嚟嘅喎。咁如果你失控咗之後咧，咁就弊家伙啦。咁你就會開始咧有吐瀉，因為細菌太多咧，你 handle 唔到咧，你開始有吐瀉嘅。咁一係你有吐瀉，就一係有結宮即係便便啦。兩樣一齊嚟，哇，好慘，即係變咗你個人咧會好煩嘅，可以講係。咁同埋咧，仲有咧，啱食完之後咧，你可能係控制唔到你個肚嗰啲即係個腸嘅 movement 啦。咁你可能啲大便開始有少少 leak 咗出嚟嘅，咁所以你個褲咧又開始邋遢咗啦。咁同埋咧，仲有咧就係你係開始咧，你啲血糖咧就好難咧去控制到嘅，因為上落落咧係好難控制。咁首先你要去睇醫生。要睇醫生嘅時候咧，醫生多數咧就因為要控制首先你嘅所有大腸太多嘅細菌嘅時候咧，你就食 antibiotic， 要食抗生素，同埋咧佢會俾翻啲好嘅 probiotic 俾你食咧，令到俾啲好嘅所謂嘅微菌俾你咧去消化嘅。咁呢個咧係一個好 typical 嘅 treatment。但係咧 on the end 咧，即係你一定要最重要咧就降低你血糖先，同埋咧就真係要見醫生去你幫手，因為冇咗醫生咧，呢個咧係未必能夠幫到你嘅。Now another problem where people who are not drinking alcohol, but they also have what they call a fatty liver disease as a diabetic, and it happens if they are not drinking alcohol, but fat cells are building all over the liver. Now, keep in mind, these are people who usually have that occasion are usually obese. Because if you're diabetic obese, you basically have a chance to develop what they call non-alcoholic fatty liver disease, which is very difficult to control diabetes. The reason is because when your liver has become really harder and then fatty, you're going to formulate a lot of reaction to insulin, and you're going to have a lot of insulin resistance. So basically with that, if you are insulin resistant, you don't gonna get insulin to your cell. So it's a catch-22. It's not gonna be good for you because your blood sugar continue goes up. And usually patients initially don't have any sign and symptom, but they find out through usually lab tests. Majority patient who is starting getting to get non-alcoholic fatty liver disease, they get very tired, they got upper pain, right upper pain up here, this part, the upper pain. They feel kind of funny and pain, but the blood test is very important. Find out is your liver function test is okay. So these are the things that really you really have to have talk to the doctor to get yourself understand where you're at to treat you. 好多病人咧，其實有個唔係酒精性嘅肥脂肪肝啊。咁其實咧，當你係飲咗酒。唔係，雖然你唔飲酒，但係你都有呢個脂肪肝嘅原因咧，就係因為好多肥咗嘅人咧，就係有時好肥胖嘅人咧，佢多數咧係會 develop 呢個叫做非酒精性嘅脂肪肝嘅。咁當你有呢樣嘢嘅時候咧，有個問題咧，就當你做呢樣嘅時候咧，你個 insulin 咧就唔會好 reacted to 你嗰啲即係有個 insulin resistant all the time。咁你個 insulin 唔 work 嘅話咧，咁糖嘅就高啦。咁變咗嚟講咧，你嘅糖會係好高啦。咁同埋咧，你個liver 越肥胖咧，就越多 insulin resistance， 因為呢個係即係佢個 reaction 係咁嘅。咁所以好多人咧，當你有呢樣嘢嘅時候咧，咁你糖係高咯，咁你個 liver 又肥胖，即係你個 liver 有個即係有個非酒精性嘅脂肪肝咯。咁好多時咧，你又會開始有痛啦。 同埋咧尤其是 up 喺呢度嘅地方會痛啦。咁點去 find out 呢樣嘢有問題咧？就多數一定要去醫生去驗血，咁然後先知道呢樣嘢嘅。咁當你有呢樣嘢嘅時候，點去 treat 咧？好重要嘅就多數第一，其實 treatment 咧就冇一個 specific 嘅 treatment 嘅。最重要係咩啊？降低你嘅磅數 ，lower your weight， 降低你嘅磅數。And then 你個 blood sugar 降低咗咧，咁你控制呢個叫做脂肪酸咧就好啲嘅。咁當然啦，醫生或者會叫你去用 insulin， 要去打呢個胰島素，因為你其實你個糖一定好高㗎啦，嗰陣時已經係。So for the treatment for non-alcoholic fatty liver disease, most likely end up is there's no specific treatment per se, but definitely the doctor will ask you to say, hey, you got to lose weight, and that's a substantial weight. I'm talking about you can lose 20, 30 pounds to get you to lower that. Your blood sugar has to tremendously improve to under control your blood sugar. And if your blood sugar are not really controlled, the doctor might even ask you, hey, we have to give you insulin to make sure that your blood sugar control. And that is very important because if your fatty liver disease are continually going up, your insulin will continue, your insulin resistance will continue goes up. So then your blood sugar will continue to go up. So that's not going to be good, okay? Now, also another thing is that affected your upper GI problem is your diabetic also affect another thing is your upper GI problem. Now this is the stomach and they will affect all these area here. So that is the upper GI, upper GI, this area. And usually what it affects is your esophagus, where you basically, you're going to sense a lot of gastric juice can come back up. So net result of that, you're going to have heartburn, feel like, wow, like over here is all burning. And on top of that, if you do a lot of that, you're going to end up, you'll feel like, oh, I have hard time swallowing because all these are being affected. Your gastric juice will come back up. So you really, first of all, you have to control is your blood sugar. Second control is you probably have to take some anti-acid pills or medication to smooth out your entire upper GI to ensure that it doesn't damage your esophagus as much more with the acid. And then you will not get it to be heartburn all the time. So that is the typical treatment. So if you really have all the time got heartburn, upper GI, yes, then you better start talking to the doctor and make sure that better control your blood sugar and take the antacid. 嗱，其實好多上消化系統係影響咧，喺糖尿病病者都好多常見嘅。最多常見咧就覺得哇，好似度揦住好痛嘅咁。其實呢個咧就係好多時就因為你個胃酸倒流。上翻去呢度，揦實晒你嗰啲成個食道，咁你個食道嘅時候揦住咗咧就好唔舒服，有陣時令到你吞都吞唔到。咁其實咧好重要咧，就要食啲咩咧？就食啲抗酸質嘅，好似 anti-acid beta-bismol 嗰啲東西，令到呢度咧就唔會繼續差落去。咁呢個係一個常見嘅東西。咁但係呢個係重要㗎，你唔想令到呢度全部都損壞咧。咁你第時食嘅就好有問題啦。So other unhealthy gut or pre-diabetic and diabetic may experience food craving, actually, food craving. What that means is because you ate so much sugar and you have so much bacteria in your gut, so you will continue more. And that result, your blood sugar will keep going up and you kind of lose control of that. And you don't want to do that, right? On top of that, you have unintentional weight gain because you eat a lot more. Guess what? You eat a lot of fatty ass diet. You eat a lot of unrefined carb, and then you promote a lot of bacteria in your gut with, and you're obese. All that will get you what? More weight, and your blood sugar start losing control, and that is not good for you. And on top of that, you may also get continued fatigue because you have imbalance of the gut bacteria. So you have all kinds of problems. You have fungi in there and microorganisms in there. So that is going to help you to get all tiring. And on top of that, you're going to have skin irritation. You have eczema, like pimple, acne. And then with that, you will have all sort of problems. So you really have to balance your gut with proper probiotics to ensure that is not get overwhelmed with all kind of bacteria in there. And on top of that, don't eat too many called inflammatory food. So that way, like fatty food, and that would definitely help you not to get your skin irritation. Now, the earlier issue of food craving and all that, the key is don't eat too much sugar. And so you don't get a lot of bad bacteria forming. So probiotic also can help you. Unintended weight gain, also cut down a high-fat diet. So, and also don't eat refined carb, get the whole food in there, like a lot of vegetable. Again, you don't want to promote more bacteria. So those are the kind of normal help to help you. Plus, if you are basically have all kind of this problem above, you will have a lot of mood swing. You don't feel good. You get very grouchy, and affected your brain. On top of that, you're going to form anxiety and depression. So some of that can be helped is actually get good bacteria into your gut, and then we'll give you more probiotics that will help you. So all that additional experience you might have, might not. I'm not talking about everyone will have that, but it's going to have potentially have that. Then you can use some of these methods I said, use probiotic and make sure that don't eat too much sugar and can help you out. So those are important other experience that you need to start thinking about. 其他仲有咧好多唔健康嘅腸胃嘅東西咧，就好多人咧就係點啊？佢就會係好想食嘢，係食好多甜嘢啊，最弊。食好多甜嘢嘅時候咧，就 form 咗好多微生物喺個腸裏邊啦，越多咧就越弊。咁最重要就唔好食咁多甜嘢。咁仲有好多時咧，你係唔係想 gain weight 喎，就忽然間嘣一聲 gain 好多 weight 啦。咁你就要食好多點樣啊？要食好多唔愛咁多 fat， 即係唔愛多肥膩嘅東西啦。唔愛咁多要 refine 你個 carb intake 啦，唔愛咁多 bacteria inside 個肚嗰度啦。咁同埋咧就係仲有咧好多時你會覺得好攰啦。咁你其實咧就係因為好多時你攰嘅就好多。你個 gut 係太多 bacteria 咧，你會覺得攰嘅。咁你個 imbalance， 即係你個 gut 嘅 bacteria 太多啦，咁你會係已經唔係一個正常啦。咁好多時咧，你就要見醫生嘅。好多時呢啲，咁好多時咧，仲有咧就要食啲叫 probiotic 咧，令到你個腸胃嘅微生菌咧係做翻正當佢。咁呢樣嘢仲有一樣好特別咧，如果你個面咧開始有好多暗瘡eczema 嗰啲出嚟咧。咁其實你可能需要真係更加好嘅 probiotic 幫助佢咧，係能夠令到你個身體能夠好啲嘅，有好啲嘅微生菌喺裏邊咧去消化系統啊。咁同埋咧食嘢咧就唔好食咁多嗰啲叫做 inflammatory food， 即係話食嗰啲嘢咧係令到腸胃遞到腫脹嘅。咁好似係好多肥胖嘢就一定係咁啦。喂 French fry 嗰啲唔好食咁多呢啲啊，嗰啲即係薯條啊。咁仲有咧，當你有好多呢咁嘅情況發生嘅時候咧，你個 mood 都唔會正仔嘅，因為你會好掹憎嘅。咁當你好掹憎嘅時候咧，會有覺得你會好多驚啦、anxiety 啦、好驚啦，同埋咧覺得有 depression 啦、有憂鬱症啦、焦慮啦。咁呢啲係全部會影響到嘅。咁最好咧，最後咧就要俾多啲 probiotic 你食，令到你腸胃咧能夠好嘅微菌喺裏邊同你消化系統好嘅。So that's something you have to consider. Okay, so in summary, and many people are kind of just keep saying that, wow, I'm going to try to lower my blood sugar, but forgot one important thing. Actually, when you're diabetes or pre-diabetic, you got to really watch is your GI tract. GI tract is gastrointestinal tract. It's the whole body, your mouth are eating in all the way to the stomach, the big gut and bowel, all that has to do that. And if you have high blood sugar, it affects your nerve. And it will have nerve damage, and which you might require some doctor understanding what happened and might need your help. The doctor might will give you guidance to help you. And a common problem of pre-diabetic diabetic will be the following, and this is the kind of things that you need to consider. The first thing is many of them have constipation. So make sure you continue to work on constipation. Make sure the bowel movement is smooth, like drinking enough water, 2 liters of Lowsutea per day, lubricate your bowel. On top of that, eat a lot of fiber diet. So like, for example, a lot of celery, adding water, forming bulk, so make it easy to come out. Don't depend it on, like just laxative. It's not going to be good. Long-term laxative, you're going to continue to screw up continue able to do it yourself. Try to do it yourself. You also, secondly, you might have a vagus nerve damage, which vagus nerve damage is actually, the brain all the way here, the nerve to the stomach, stopping or slow down stomach, pushing food to the intestine. That is going to be an issue. So first of all, you have to lower your blood sugar, decrease the blood sugar. Second is the doctor might give you medication. The third is you might want to, the doctor get real worse, then you might get a stimulator in there to help you to stimulate. Now, diabetic enteropathy is going to be an issue because you get entire body of the gut from the small intestine, large intestine, everything actually start affected. And a lot of times you accumulate because of slow down your bowel. So you end up to be, your bowel is slow down, and so you get more excessive bacteria. So with that, the doctor might have to treat you with antibiotic and give you proper probiotic to help you to get your bowel regular movement again. Upper GI problem will be affect esophagus. You're going to have gastric juice come back up. Then that will be very damaging. You'll have a lot of pain and then so forth. So you might have antacid. You have to eat. You might have treated antacid to make sure no damages. So make sure you do that. And also on top of that, you have a non-alcoholic fatty liver disease, which is you don't drink, but the problem is when you have fatty liver, you affect your insulin to work. You have high insulin resistance, so you have to control that by lower blood sugar. That's the key. And other things like food craving, unintended weight gain, fatigue, skin irritation, mood swing, all those you have to figure. Way one is lower your blood sugar. Maybe by a lower blood sugar diet also can help you is also give you proper probiotics to help you to give you better bacteria so you can able to digest, get you back to the normal range. So this is the really summary of today's lecture. Let me say in Chinese also. 嗱，各位堂友，好多糖尿患病者都好驚奇啦話，喂，我糖尿病都會影響我個腸道嘅問題嘅咩？咁其實呢個係一個好大問題。當你高糖嘅時候咧，你係會第一係影響咗你個stomach 喺個腦落嚟嗰個叫 vagus nerve 咧，影響個 stomach， 能夠令到佢個muscle 咧 stomach muscle 唔識同你 push 啲食物咧去推啲食物落去你個小腸嗰度。咁嗰陣時咧，亦都有個因為咁情況咧，你個腸開始咧，亦都可以慢咗咧，咁你就會有一個便便啦。咁呢啲嘢全部係可以係有機會早啲控制到嘅。Besides 同你醫生傾下偈，點去做呢樣嘢，令到俾啲東西你能夠幫助你，能夠令到你唔會便便啦。咁便便好重要咧，就係要飲夠水，或者飲夠去糖茶，每日飲2公升咧，令到你係夠水分咧，去令到你嘅腸咧係唔會係 overly 即係乾得滯。咁仲有咧就係你個 vagus nerve 係如果 damage 咗之後咧，咁你就好多時咧嗰啲食物喺個 stomach 嗰度咧推唔到出去個小腸度。咁嘅情況下咧，你可能要食藥啦。咁仲有咧就要降低血糖啦。如果真係好差嗰啲咧，佢可能要放一個叫 stimulator， 呢個儀器喺個胃嗰度係 stimulate 呢個 vagus nerve 咧，係去推啲食物去個小腸度。咁仲有呢個上面個胃咧，喺個胃同埋個食道嗰度咧，開始咧有痛啦，因為胃氣同埋嗰個所謂嘅胃酸倒流啊。 咁胃酸倒流咧係會揦住個喉嚨嘅，會好唔掂嘅。咁呢個咧係會令到你係好唔舒服啦。咁你係唯有只係能夠令到食好啲嘅，食翻啲 anti-acid 嘅藥物啊，同埋你睇醫生啊。咁同埋仲有一個咧就係、你冇飲酒啊，但係點解你都有肝脂肪肥肝脂肪嘅咧？就好多時咧就係、因為糖尿病咧係有依樣有好多糖咧，令到肥脂肪會發現嘅。咁當你發現嘅時候咧，佢好多時咧就係、佢令到你嗰啲 insulin 咧就會有 resistance。咁首先第一樣嘢咧係要降低血糖。咁醫生亦都可能會要同你打胰島素啊呢啲東西啦，降低血糖係 key， 因為 treatment 就唔係好多噶啦。咁仲有咧就好多時咧有好多糖尿病患病者咧佢係肥胖嘅，咁佢肥胖咧就會成日都好想食多嘢，食好多糖。咁呢個咧就係降低，繼續降低血糖，降低血糖。咁同埋咧就如果你係 gain 咗磅咧，降低血糖，減磅啊。咁減咗磅之後咧，同埋仲有一樣咧，可能要加多啲叫 pre-diabetic。咁嗰啲嘅好嘅即係益力多嘅東西啦。咁令到你咧能夠有呢個無糖嘅益力多係最緊要啊。咁令到你咧就有啲好嘅 bacteria 喺個肚嗰度咧同埋 digest。因為如果唔係咧，你會有 end up 咧有個 skin irritation 啦，個面開始發暗瘡啦，同埋咧你好猛震啦，因為你太多 bacteria 裏邊啦，唔係正當 bacteria係令到好唔掂嘅。咁今日講咗咧，就嚟到呢個時間到咗啦。咁記住，真係能夠飲去糖茶咧，降低血糖，每日咧係飲2公升。咁你夠水咧，一定係令到你咧個 constipation 係，即係你個便咧係唔會有呢個好嘅便嘅。嗱，記住唔好谷，記住可能夠，如果需要咧係按摩呢度咧，係令到 stimulate 你個 nerve 咧係俾你去大便嘅。同埋依兩笪地方啦，記唔記得上一次個堂啊，或者依度啦 ，OK？ 依度啊，咁依度啊，咁令到你咧能夠令到你咧係 stimulate 個 nerve， 令到係可能夠去大便。So remember last lecture, I have a pressure point here, which can be help you to stimulate your nerve to push your bowel movement out. So very important, push here, push here, and put two side. And then also right here, okay, to push this. So when you push all that, it will actually stimulate your bowel movement better. Hopefully you can able to mix too. So today is the lecture I just finished. I hope that it will help you to better be sensitive to know what is the importance of your gut. And on top of that, if you have any question, you can write to me or call me, and I'll get your phone number here. Right here, so you can able to write to me, and hopefully that I will answer a question, and hopefully that this lecture will give you an idea what is important to have a healthy gut. Now another thing, I hope everybody will come to attend next week webinar. Next week webinar will talk about diabetic kidney disease. It's a very important webinar to attend. The reason is because we're going to have Professor Larry Chan to give you all the information, and majority people found themselves in diabetic kidney disease are in surprise. In other words, people are actually, you mean I have a kidney problem? And at that time, many of these people already with a kidney disease up to only 40%. If you have 10 more percent, 30%, they end up with dialysis. So it's a very interesting, a lot of the diabetic patient would not know they have kidney problem. So I think this is something that will highly educated to let people you should attend so you better understand. 各位朋友，希望下個禮拜你能夠聽Professor Larry Chan 講講乜嘢叫做糖尿病，令到你個腎有問題。令到你能夠將來真係可能要洗腎，係點控制同埋點能夠令到你個病唔會一路延長落去，終歸 end up 洗腎。咁下個禮拜咧係一個十分好，3月26號11點鐘係呢個我哋講座。So next week for the Hawaii time is March 25th at 5 p.m. So make sure Hawaii is March 25th at 5 p.m. For Hong Kong time, it's March 26th at 11 a.m. So make sure you guys attend, and hopefully that we can learn all about what is the diabetic kidney disease. Okay, if they have no question, I wish everybody a happy weekend, and I'll see you next week. It will be a very good lecture next week. So make sure you sign up, attend. And if you don't have the sign up, or write to me, I'll send you the invitation also. But you should receive it. You didn't receive it, let me know. So write to me if you don't receive it. This is the email address. Write to me, andy@wahfong.com, andy@wahfong.com. Do write to me. I'm looking forward to talk to you next week. Aloha. Bye-bye. Thank you.